Patient first was really what drew me to the OSF mission, and serving with the greatest care and love. That really struck me. Whether you are a faithful person or not, whatever you believe in, I think it's important to have that, and that's really what stood out with OSF.
The mission of OSF, taking care of all persons and doing it in a way that provides the highest quality care, really resonated with my personal values and beliefs.
I think everyone who gets on board with OSF has this clear understanding when they're signing their contract that their mission is to serve the patients. And so there has been a push to centralize care and make it, in a sense, a one-stop shop for women, in our field at least, to get all their healthcare needs in a centralized location, whether it's OSF in Peoria or Rockford or anywhere.
A lot of patients appreciate that we are a faith-based organization. No matter what faith you come from, I think faith is something that brings people together. It's something that a lot of us have in common. It's nice to be able to share that with a patient and tell a patient that I will pray for them when I really do pray for my patients, and care for them as if I was caring for my own family.
I could not thrive and continue to help patients on an ongoing basis without this continual support and networking that we have in this big system. I take pride in the level of complexity of interactions I have with the providers around me, and it helps me provide better care for patients.
Knowing that I have that support really allows me to concentrate on doing my job and doing the best thing for my patients and the physicians that I lead, with the comfort of knowing that when the day's tough, I'm not doing this alone. I'm doing this with the support of the other people that I'm practicing with and my leaders.
I come from a family of 2 physicians. I knew from a very young age, from elementary school, that's really what I wanted to do.
When I graduated, I was looking for a job that would allow me to teach and also expand on my surgical skill set. And then I heard that OSF was hiring in collaboration with university. They were looking for someone who was young, academic, full of energy, full of new thoughts and ideas. And so I took the position.
So in my 22 years with OSF, I've now been able to take care of 4 generations of the same family. And that's, for me, has been incredibly rewarding, because you can see how the different generations interact and how the health or illness of one generation has an impact on the other generations.
So for those who are looking for a nice balance of a work-life setup, and also looking for growth, personal growth, whether it's leadership or clinical skill set or academic opportunities, OSF is a very well-balanced place to grow in all these aspects.
I have adequate time off when I have family things going on that I need to attend to. OSF has really worked hard with our EMR to try and unburden the providers so that we aren't spending as much time outside of clinic in our EMR, because OSF really does want us at the end of the day to get home to our families.
There's camaraderie amongst physicians and nurses and advanced practitioners. There's room for growth and leadership opportunities.
I think that OSF really allows physicians an excellent opportunity to come and have all the resources at their disposal to provide top-notch care for their patients in an environment that's already designed to deliver those outcomes while being very supportive of you as a clinician.
Leadership will make sure that you continue to grow. They will involve you with the committees, the academic opportunities, the ministry-wide initiatives that allow you to shine, grow, and continue to provide the care that you would like to provide.